A leap in second is a jump executed by dancers where both the arms and legs are extended out to the side. The pelvis is made up of 3 bones, the ilium, the ischium, and the pubis. The acetabulum articulates with the head of the femur, creating a ball and socket joint. The hip is a highly mobile joint due to its bony anatomy. Bony landmarks of the hip include the anterior superior iliac spine, anterior inferior iliac spine, acetabulum, obturator foramen, posterior superior iliac spine, ischial tuberosity, and sciatic notch. The hip gets some of its stability from the large ligaments that connect the head of the femur to the acetabulum. These ligaments are the pubofemoral, iliofemoral, ischiofemoral, and the round ligament. The hip has many large muscles. Anteriorly, there is the iliacus, so is major and minor, rectus femoris, sartorius, pectineus, gracilis, adductor magnus, adductor longus, and adductor brevis. Posteriorly, there is the gluteus maximus, semitendinosus, semimembranosus, and the biceps femoris. The deep posterior muscles consist of the piriformis, gemellus superior, gemellus inferior, obturator externus, obturator internus, and quadratus femoris. Laterally, there is the tensor fascia latae, gluteus medius, and gluteus minimus. The knee is made up of the femur, patella, tibia, and fibula. The femur and tibia articulate to create the tibiofemoral joint. The tibiofemoral joint is classified as a hinge joint because it allows for flexion, extension, and some rotation. The patella connects to the femur via the patella tendon, creating the patellofemoral joint. The patella works as a pulley, creating a greater mechanical advantage during knee extension. Important bony landmarks of the knee include the medial and lateral condyles of the femur, Gerdy's tubercle, and the tibial tuberosity. Ligaments of the knee include the anterior and posterior cruciate ligament, the lateral and medial collateral ligaments, and the lateral and medial meniscus.
Anterior muscles of the knee joint include the rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. Together, these muscles make up what's called the quadriceps. On the posterior aspect of the knee joint is the biceps femoris, popliteus, semimembranosus, and semitendinosus. Together, these make up the hamstrings. The bony anatomy of the foot and ankle includes phalanges, metatarsals, cuboid, navicular, talus, calcaneus, tibia, fibula, and cuneiform. The medial deltoid ligament of the ankle is a strong ligament and attaches to the medial malleolus. The lateral ligament of the ankle is made up of 3 bands that start at the lateral malleolus. The anterior talofibular ligament runs to the lateral surface of the talus. The calcaneofibular ligament runs to the lateral surface of the calcaneus, and the posterior talofibular ligament runs to the lateral tubercle of the talus. The superficial posterior compartment includes the gastrocnemius and soleus. The deep posterior compartment includes the tibialis posterior, flexor digitorum longus, and flexor helicus longus. The lateral compartment includes the peroneus longus and brevis. On the anterior compartment, there's the peroneus tertius, extensor digitorum longus, extensor halicus longus, and tibialis anterior.
During phase 1, the left ankle is in dorsiflexion and slightly pronated, the right ankle is in plantar flexion, the knee is flexed, and the hips are also flexed. The peroneus tertius, extensor digitorum longus, extensor hallucis longus, and tibialis anterior are all acting to dorsiflex the ankle and foot. The peroneus longus, brevis, and tertius are mainly responsible for the pronation of the foot. The gastroc, soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, peroneus longus, and peroneus brevis are muscles that act to plantar flex the ankle and foot. The flexor digitorum longus and flexor hallucis longus are the flexors of the toes. The rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius are eccentrically contracting to flex the knee. The semimembranosus, semitendinosus, biceps femoris, and gluteus maximus are all eccentrically contracting to flex the hips.
During phase 2, both the left and right ankle is in plantar flexion and the toes are flexed. Hip flexion continues in addition to external rotation. The knees transition from flexion to extension. The gastrocnemius, soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, peroneus longus, and peroneus brevis are muscles that act to plantar flex the ankle and foot. The flexor digitorum longus and flexor hallucis longus are the flexor of the toes. The iliacus, psoas major and minor, rectus femoris, sartorius, pectineus, gracilis, gluteus minimus, and tensor fascia lata are all responsible for hip flexion. Some of the same muscles are also acting to externally rotate the hip. The iliacus, psoas major and minor, rectus femoris, sartorius, pectineus, biceps femoris, and gluteus minimus. In addition, the 6 deep posterior muscles, the piriformis, gemellus superior and inferior, the obturator internus and externus, and the quadratus femoris are all external rotators of the hip. The knee extensors include the rectus femoris, the vastus intermedius, vastus lateralis, and vastus medialis. During phase 3, the left ankle is in plantar flexion with the toes flexed. The right ankle is in dorsiflexion with slight supination. The hips remain flexed and slightly externally rotated, and the knees return back to flexion during the landing portion of the jump. The left ankle and foot. The gastrocnemius, soleus, tibialis posterior, flexor digitorum longus, flexor hallucis longus, peroneus longus, and peroneus brevis are muscles that act to plantar flex the ankle and foot. The flexor digitorum longus and flexor hallucis longus are the flexors of the toes. The right ankle and foot. The peroneus tertius, extensor digitorum longus, extensor hallucis longus, and tibialis anterior are all acting to dorsiflex the ankle and foot. The main muscle working to supinate the ankle and foot is the tibialis posterior. Muscles acting on hip flexion include the iliacus, psoas major and minor, rectus femoris, sartorius, pectineus, gracilis, gluteus minimus, and tensor fascia lata. The external rotators include the iliacus, psoas major and minor, rectus femoris, sartorius, pectineus, biceps femoris, and gluteus minimus. In addition, the 6 deep posterior muscles, the piriformis, gemellus superior and inferior, obturator internus and externus, and the quadratus femoris. Muscles flexing the knees include the biceps femoris, popliteus, and semimembranosus and semitendinosus.